at 176. So I do want to say, and this is primarily testing has pretty much come to a halt in this area, other than for like hospital workers and things like that. So it's a thing that Dr. Whalen and I have been pushing for. We're working on. We're doing our due diligence, and we're hoping to have a great response to everyone in the next couple of days about trying to get testing ramping back up. We have 548 people under mandatory quarantine, 234 people under precautionary quarantine, and there are now 14 people being hospitalized, with our hospitalization rate at 7.9%, and those who have tested positive. 6 adults are in the ICU, and the hospital range now is from 25 to 75, which is good news, you know, that we're seeing that. And there's 247 individuals under precautionary quarantine. So if you look at our numbers in the graph where it all started, March 12th, to where we're at now, and I want to say this, we've gotten some great Facebook response. We've had people email our office. The total number is the total number. Yes, it could change with people coming off of it after they're done with their quarantine, and you could take that away. Do the math, people. March 12th, first 2 cases. Do the dates, 14. They should come off, right? But that's the number of people that the Department of Health has dealt with, and not just the 176, but all the precautionary and everyone else that they have to map and trace. And they're doing a phenomenal job doing that. Even though we lost the 400 students, thank goodness, the other day, we're still dealing with, you know, churches and other ones that are exposed and tracking them down. So that's the number that we deal with, regardless, you know. So there are people that are recovering from this, which is great, and that's the news we want. We want 100% of recovery. But, you know, to sit there and try to say that number is less, honestly, and I don't want to put Dr. Whalen on the spot, that number would be a lot higher if we were continuing to test at the level we were a week ago. I would say we'd probably be close to 500 numbers right now, and that's why I say to everyone, it's around. Plan on it. It's in every community. Take the proper precautions. Stay home. Stay home and self-isolate for the next week. I know the weather's nice. I know people want to get out. Please, just stay home and do the right thing. One of the cases, you know, I should say we don't want to give people a false sense of security and should continue to practice the social distancing. But since the beginning of all this, I implemented strict guidelines at our nursing home, knowing that that was the most vulnerable resource that we have, and I say that in a caring way. They're our residents, and it's our time to take care of them now. And one of the things before even the governor decided to shut nursing homes down, we started to take that precaution. We put protocols in place and got really strict quick because I was watching what was going on around the world, and especially in Seattle. We stopped visitors from coming in. We started putting hand sanitizers or stations all over the place, masks, and we started testing the workers as they come into the building for the temperature and other things, and having people fill out paperwork. Unfortunately, but fortunately enough, and I say it both ways, one of our workers did contract COVID-19. Wasn't at work, got stopped before they came back into the nursing home because of the precautions that we put in place. And this individual, was out for a little while, came back, had a temperature, and we didn't let him back into the nursing home. This person didn't come back in. So we caught it. So our stuff is working. Our mechanisms we put in place to protect everyone. And one of the things too is that, you know, obviously we looked and we did mapping and tracing in the nursing home and made sure this individual worked, that we are monitoring that section more so than even before. So nothing has changed up there. Everyone is still fine. And I want my hats off not just to the staff up at the nursing home, but to Larry Slacky and his administrative team that have been doing a great job through all this, and I can't thank you enough. By social distancing and self-isolation, and I don't want to say self if you have someone in your house with you, it is going to slow us up, and it's going to help our hospitals, and it's going to help free up beds, and it's going to help not clog up ERs or first stops and that type of stuff. So that's why these protocols are in place, you know, and to identify things before they happen. So I just want people to be aware of that. Starting Monday, our food bank, with a partnership, Albany County is partner with the Regional Food Bank of Northeastern New York on Monday to help deliver food to people that are quarantined, that can't get out of their house, people that might not have the opportunity because they're under precautionary quarantine. We're teaming up. We're going to be running food at the Times Union Center, and the National Guard has come in. They will be helping us, so you'll see a presence of the National Guard starting here on Monday to help deliver food and do some other stuff. So I can't thank General Shields and the New York Army National Guard enough for their assistance in this, but most importantly for Governor Cuomo's leadership throughout this. It's hard when you're making decisions and you're trying to do the best for all New York. You know, it's not every decision we make is going to be right, but I can assure you every decision we make is to make that decision to help the people that live in our county. Like we had Dr. Giugiano here yesterday, and we talked about anxieties, and we talked about people. You know, that's why I established Day 2, the mental health hotline, for that reason, so people can reach out and they can call. And trust me, they've been getting busier. And I listen. There's no shame in calling. There's no shame in feeling different, because it is a different era we're living in, and it's going to be this way for a while. And even for parents that are home dealing with kids full time, around the clock now, you know, it's going to get very stressful for you. I was there. You're going to be there around the clock with your children, sometimes, you know, for 7 days a week. And you know, look at our YouTube videos. Go on our Albany County Cares website, and you're going to see a lot of different videos you can do. At least entertain them and keep them busy a little bit. But again, we're in a different time, and this is where leaders need to lead. And the decisions we make today will be judged on tomorrow. And keep that in mind, you know, and we have to continue to work in partnerships. We have to continue to be good neighbors, and we have to continue to be there to help the people. And, you know, talking about that, one of the great things is the Medical Reserve Corps, the volunteers that come in volunteer, even when this isn't going on. Like I said, there's a lot of things you don't know go on in the county. But they're there all year long, and they volunteer their time to come in and set up for emergencies like this or epidemics. And who knew? But I do have the one person with me right now, Angela Sears. She's an RN at Albany Academy. And Matt Miller is actually a county legislator representing the 36th legislative district that includes Glenmont, Selkirk, and South Bethlehem, who actually has been volunteering. I went down there day one. He was on the phones, and I go, I know that guy. I'm like, he's that new legislator. But doing a great job, Matt, and I can't thank you enough. But when we talk about social distancing and everything else, I'm going to let Angela and Matt speak on it before I turn it over to Liza. Angela?
Hi, as I said, my name is Angela Sears. I work as a school nurse at the Albany Academies, and we are actually on break this week and last week, so I was trying to find something that I could do to help out, and I couldn't quite, figure it out for a while, and, we had canceled our vacation, so I knew I was going to be home for 2 weeks, and I was watching the news of these press conferences, and I had seen them talk about the Medical Reserve Corps and decided, that I should probably take a look at it and see if that was something that I wanted to do. So I went online that night, signed up, and within 2 days I was down at the Albany County, Health Department helping out. And some of the things that I was doing, I do a couple of things. I first started out returning phone calls for anyone calling to get their results. So anyone that either had a negative or their results weren't back yet, I was making those phone calls, and there's a lot. A lot of people were tested, so there were a lot of people calling. And it was time consuming because, it's not just as easy as saying you're a negative or we don't have your results. A lot of them had a lot of questions or were anxious, especially if their results weren't in. So it was time consuming for all the people working there. I worked with a lot of great, Albany County employees already who I've grown to really enjoy working with. I did that for all of last week, and then this week I started making intake calls for people who needed to be on mandatory quarantine from having exposure to positive COVID cases. So with that, you basically just, talk to them, get their address and phone number, because they're going to have daily visits and daily phone calls to check on them. You get any symptoms if they have any, but you also talk about who else might live in the household, how they can social distance within the house. Do they have an extra bedroom if they, have a partner that they could sleep in rather than sharing the space? Cleaning shared bathrooms, shared kitchen spaces, countertops. And then also I felt like the most important thing was if they're quarantined and they don't have anyone else that can help them, we ask them if they have availability to food, to their medications, to their medical supplies. And if they don't have anyone, friends or family, we try to hook them up with those resources so that they can be able to do that. So those are the main things that I've been doing. And then anything else. There's so many different things that you can do to volunteer there. And even the people that work there every day, you never know what your job is going to be, because it's constantly changing. One day you might be doing one thing and you come in the next day and they have you doing something else. It's been very rewarding. They're working so hard at the health department, but they need volunteers and they need our help as well. So I'm hoping that other people will be able to come and volunteer as well, because I've found it really rewarding, and I can tell that everyone appreciates it. They know that they need volunteers to keep this work up, because it's a lot.
Thank you. Matthew?
Yeah, so my story is fairly similar. 2 weeks ago, I'm a teacher by trade, so I'm county legislator, but during the day I'm a biology teacher. So I knew I was going to have some time at home now, additional time, free. And Andrew Joyce, the chairman of the legislature, had put out something about the Medical Reserve Corps, and I saw they needed both medical and non-medical people. So I thought it'd be a great opportunity to maybe help out in time of need. So similarly, actually, I called on, I went online and filled it in on a Friday afternoon about 2:30, thinking, all right, they'll get hold of me next week and do some training and figure it out. And I got a call 2 hours later. They said, can you come in and give us 4 hours tomorrow? So I came in, started doing that. It actually, that kind of help they need. They would take us 16 hours a day if we could do it. So I've been given that amount of time, and it's very similar. So right now we're doing is making those phone calls. When I started out, it was just doing that. It was calling people on lists and telling them you have to go into quarantine, so it's a little scary for people. And then also saying to them, people were calling in on their own saying, hey, I was at this place, do I need to go into quarantine, and telling that the same. But now it's very different now. We're getting to tell people that they're negative, you can get out of quarantine, go back to your life, so they're much more happy to hear from us now than they were in the beginning. I'm also very impressed with what the Department of Health and Dr. Whalen's team is doing. It's amazing how much everything, in the 2 weeks since I've started, how the mission changes basically every day. The systems and the process has to change every day. And they're managing that on the fly, making sure everybody's right on track, on target, and then handling everything that needs to be done is very smooth. And I think the people that are calling in are very satisfied with it. So it has also been rewarding, satisfying for me. I wish I could give more time than I do. I hope more people will join up. Teachers, we still have to teach a little bit during the day. So the great part is, they have shifts they like you to do, but if you can't do the whole shift, you can only do a certain amount of time, they'll take whatever time they can give. So thank you.
Thank you. And before I turn over to Dr. Whalen, I do want to say with the 548 people that are under mandatory quarantine and 234 that are under precautionary mandatory, there are rules and policies in place. They are not allowed to go out. It's not like the precautionary. We have had some people that have not been abiding by it, and that's why when it comes under Dr. Whalen's leadership at DOH and the people going out and checking on them, it gets difficult. Especially when people feel like, hey, I'm okay, I'm going to go out. No, you're there for a reason. And we've had to send police departments to their house, and we had to let them know if this continues, we don't want to fine them or lock them up, but if they are not doing what they need to do to protect the residents and their neighbors around them, we're going to have to make that step. So. But most of the people, probably 97 or 98% of the people are paying attention. They're doing what they need to do. But there's always that small number of people that just think they know better than doctors. And talking about that, Dr. Whalen.
Thank you, County Executive McCoy. First of all, I just want to express my gratitude to the members of the MRC that are at the Health Department, and particularly to Matt and Angela, who came here today to share with you some of the work that they're doing. The fact of the matter is, we could not have the response that we have been able to have without these members of the MRC who are volunteering their time. And we are so lucky to have such skilled people come and assist us with the essential work that we're doing every day. Our MRC accepts people year-round. We work during non-outbreak times as well, planning and drilling for events like this, for mass vaccination efforts, if that were to come to pass, and hopefully that'll be something we're looking at, not any time in the near future, but when a vaccine does become available, for many medical countermeasure exercises and others. So Matt and Angela have been exemplary, and I am lucky to know Angie through Albany Academy and can attest firsthand to what a wonderful nurse she is. And we're really very grateful for the work that our volunteers are doing. We have many phone calls that are being made to the department. People have a lot of questions, understandably, and particularly around issues like quarantine. What does it mean? What do I have to do in my home? And to provide that education is not always as Angela said, it's not always a quick conversation. So to have these skilled individuals that can take training on the fly, that can incorporate the message, that can be nimble as we have needed to be, because operating a large-scale effort like this requires us to do a continuous look at how our processes are evolving and ways that we can streamline things. And from an administrative level, we're doing that, and then we're translating that onto the people that are doing this work, and every day they just say, okay, we'll do what you need us to do. We'll do what we need to do. And they take the time to get the knowledge that they need to give the public accurate information, and really without them we couldn't be doing what we're doing. So I again want to express our extreme gratitude for these workers that are assisting us every day. In terms of what the county executive spoke about in terms of quarantine, you know, I don't want people who are on so-called voluntary quarantine to think they're getting a free pass. They still have to stay at home. We're still following you every day, and if we think you are out, we will convert you to mandatory, because this is the way that we control this disease in the community. These are the mitigation strategies, and really right now this is our only mitigation strategy. In the absence of being able to conduct large-scale community testing, the only available strategy that we have right now is the community mitigation strategy and advising people to stay home. In general, even if they're not on quarantine, individuals who have not been told you need to quarantine should still be taking on those behaviors. They should still be staying at home. They should still be avoiding social interactions. Yesterday was a beautiful day. When I drove home yesterday evening, I saw a lot of people out, and a lot of people out playing basketball on the park that I passed, a lot of people in groups. This is not something that we should be seeing at this point. Please make sure that everyone who's listening to this message educate as many people as possible that they should be avoiding any kind of group settings, whether they're inside or out. We do understand the importance of people wanting to be outside and exercising. You can go out for a walk, just keep your distance. This virus spreads pretty readily. We know that for every person that gets it, they're likely to infect 2.2 additional people. So the only real measures we have for control is to keep people away from each other. And whether you have been told you're on quarantine or whether you are home, if your school has been closed, there's a reason for that. The reason for that is that we don't want kids close together. So if your kids are saying they want to get together with friends, if they are saying they want to have sleepovers or play dates or hang out with a group, the answer should be no. Again, I have 3 teenagers at home myself, and I know the concerns and the challenges with this. It's not easy. But once you are firm with that message, your kids will understand. They should understand, because they are helping to save a life if they stay at home. We say this every day. Every day I look for a different way to craft this message to the public, because the importance of it cannot be understated. We see what's happening downstate. The situation in our hospitals locally, I continue to be updated on daily. And at this point, we do have available hospital beds. We do have available ICU, and we do have available ventilators. But if we are looking at what's happening downstate, we know how quickly that can change. And the only way that we can affect that situation not arriving at our doorstep is to stay at home, is to continue to follow the recommendations that public health is giving you on a daily basis. The epidemiology that we're seeing on COVID-19 across the United States is different than we expected. The messages that I'm giving you now may be different than the messages I relayed a couple of weeks ago. We know now that this is affecting young people. We know that we are seeing young people hospitalized in our local hospitals. And hospitals don't take you as an inpatient unless you're pretty sick. So this is not something to be taken lightly. This is the message that this is likely not to affect young people is a yesterday message, not a today message. So please protect your children. Please protect your families. Please protect the families of others. We continue to watch this on a daily basis. We continue to follow along with the efforts that are being conducted statewide and across the country. There are concerns. There are concerns related to the availability of testing in our particular county, and I believe these are in all upstate county health departments. I reached out yesterday to New York State Association of County Health Officials and found that most county health commissioners and county health directors north of the New York City metropolitan region are having similar problems accessing widespread community testing. What this does is gives us a false sense of security and a false sense of what is going on. We don't know what's going on in our community because we haven't got this testing. County Executive McCoy has been fervent and tireless in his efforts to advocate for us to have testing. And I appreciate his support through this every single day and every single night. It's a challenge. It's a challenge, and this challenge right now is giving us a false sense of security. We need to continue to press on to get these tests. We need to continue to press on with our messages so that people understand the concern, so that we don't turn into what's happening in New York City in a week from now. 2 weeks ago, I gave the message that what you do today will influence what happens tomorrow, what happens next week, and I again reassert that message to everybody in the public to listen to. We continue to work on this day and night. We appreciate the support of the county executive and all the county departments that are working with us on this, and we will continue to follow this along with you and to share these messages with you and information as we get it. Thank you.
Thank you, Doctor. Any questions? Yes, sir.
As your newer patients are, some of them are healthcare workers, some of them quarantine, assuming are their coworkers. How close are we to a strain on making sure we have enough available healthcare workers in the ICUs to take care of patients?
So again, this is something we're going to be monitoring going forward. Right now, I think that it hasn't gotten to the stage where it is impacting our provider community to the extent that they cannot provide the care that will be needed by the residents of Albany County. But we're continuing to monitor that.
Do you guys have an estimate? I know there's no way of really knowing, but an estimate as to when we're going to see a return to community testing?
I'm hoping to have an announcement in the next couple of days.
Governor Cuomo, the county executive, and the county department of health commissioner have all now said that they've seen people on basketball courts repeatedly over the past week or two. Is there anything that can be done from an executive level, I guess, to stop that?
The governor took away that authority for us to do that without pushing it up to the Department of Health, which we have. As last week, I called on a variety of things to be closed for this reason, you know, one of the things I did talk to Mayor Sheen brought up to my attention about taping them off. At Lawson's Lake, we put, you know, caution tape around all the playground sets and everything else to keep people off of them. I will say to the people watching this and listening to this, like I said a couple days ago, wake up. what do you want? Your kids playing with the germs and bringing it home and getting contaminated and spreading it more? So it's not worth going down that slide or going down that swing or, jumping on the bars. So please stay off of them, and we're hoping that the state will put out a thing that they will be shut down.
Do municipalities, so like do the towns, the cities, and the villages, and the county still have that authority, though if they're, like, if it's a playground owned by the city of Albany, does the city take the steps to close it?
I think they're looking for guidance up to our level, but I believe most of them have taken them steps to do that, and I commend Mayor Sheen and everyone else that has taken them steps.
We're seeing today that some area golf courses are opening, and I'm just wondering thoughts on that.
I have said this, and I'll say this again. They should stay closed, but I don't have the authority. If I did, I would have closed them. I think it's great. I saw Capitol Hills was packed, too packed. People weren't social distancing, but they were walking the course. They were getting fresh air. They were walking their dogs. They were with their kids. And I know there was an issue. They had to make sure to address that issue. I'd rather see that on our golf course than two people social distancing, taking the ball around, because like Dr. Whalen said, we got to realize this is real. The world has changed, and yes, we want you to take that anxiety and take a step back from it, but the only way you're going to do that is realize things have changed, and go for a walk, other than playing golf, but that's not my call.
In the neighboring Rensselaer County, Executive Steve McLaughlin has called for a travel ban or pause of sorts on people from downstate and says they may be bringing it up here. Have you seen similar evidence in Albany County, and would a travel pause be advantageous to stop the spread?
I knew this would be coming from Darrell, and I got ready with the quote behind me hanging up in the TV. I'll say this to everyone out there. We're elected to lead. We're elected to take care of the people, but little quote that I like, and it's out there, is if there's a thing I've learned in my life, it's not to be afraid of responsibility that comes with caring for other people. That's how I'll answer your question. Next question.
I
Yeah.
think, sorry, I was trying to cut out there. I think right before we came in, I think I saw something that Governor Cuomo was considering transporting downstate patients from the state hospitals to spend summer leave there. Is there any concern that you guys have with that plan?
Where, like Dr. Whalen said, I don't want to speak for her, but, I've talked to Dr. Reed and Dr. McKenna, right? Correct? And this is an issue that we just want to make sure we have enough beds. We're taking that proper steps, and, I think they're looking at the idea, and I don't want to assume what the governor's people are thinking. We're working with them, and it's not people COVID-19. I think it'd be for other minor things that they could free up some space down there for the epidemic that they're faced with.
If the governor didn't remove the various forms of authority you had to make executive decisions during this pandemic, what steps would you have taken that you can't take now?
Darrell, it's easy to be a Monday quarterback. I'm not going to do that. That's not time for now. Time's for leadership and moving forward. Any other questions? Thank you.